Good day, everyone. My name is Catherine Duggan. I'm the Chief Executive Officer here at the International Pharmaceutical Federation, FIP. The FIP is the membership organisation for pharmacy, representing pharmacists, pharmaceutical scientists, and pharmacy educators from around the globe. We have about 150 member organisations, and we have 170 academic institutions, and represent around 4 million pharmacists, pharmaceutical scientists, and educators. I'm delighted to be here today to welcome you to the first in this mini-series of Fireside Chats. And I have with me today Sandra Carey, Global President of McCann Health. McCann Health has worked with FIP for many years. And since I joined in 2018, we've continued our collaborations. And Sandra and I have had some big conversations over this time about the future of pharmacy and our profession. So we wanted to expand these and to see how we could start the discussions more widely. We've really been thinking over this time in this time of COVID-19, about how McCann Health and FIP can amplify the work that pharmacy has been doing. And additionally, thinking about the opportunities pharmacy has taken during this time, the impact COVID is having on pharmacists in guiding and treating patients looking for solutions to problems that have been exacerbated by COVID, but also some of the regulatory changes in the profession as well. Sandra, your reflections.
Hi, everybody, and thank you, Catherine. It's very exciting to be working with FIP on really exploring deeply what's happening in the pharmacy space. And as we continue, there's some really good trends that are happening right now that we're seeing as we move more into COVID. We can't really say it's post-COVID at this point, but move into the pandemic and what's happening. We're seeing a hyper-localization of consumers for care. They want to stick close to their communities. And with pharmacy being such a trusted center point, it really is positioning them well to be that first point of immediate contact within the healthcare system. There's a reluctance of people to go to emergency room and family healthcare teams right now with the fear of contracting COVID. So when we think about all of the things, and it's almost like the perfect storm. There's a focus on safety, there's a focus on wellness, and patients/consumers need more help. Pharmacists have in the past have not really leaned in to take advantage of all the opportunities. And the point of these fireside chats is to really think about what the opportunities are that are being presented to the profession and how we can actually help stimulate the discussion and really helping the entire industry understand the value that pharmacists bring. Catherine?
I agree completely, Sandra. In the discussions you and I have been having, probably more frequently during the COVID pandemic, actually, that's one thing I would say, that we have to make more proactive time to have discussions together when we're not relying on face-to-face. You and I have realised very quickly it's two passionate pharmacists discussing pharmacy, and it's time to get an outside perspective. Because otherwise it can become a little inward looking. We can see the opportunities, but we can also see maybe some of the barriers because we are part of the profession itself. So you and I decided that we needed to get a few global leaders in health to set us straight, to kind of tell us where they see the opportunities and the challenges and advice they have for our profession, and that we can take this forward between McCann Health and FIP to make sure externally pharmacy is well positioned, but also internally in the profession, they're well supported. So I want to say, go on, Sandra.
Yeah, no, I was just going to say, you know what, we can have all these discussions we want, but it's bringing in some of the global leaders like we are going to do now that really kind of help us get a firm grasp on what's happening. And so that external view, looking outwardly to see from some of the, I believe, most well-positioned people globally, really will help us in how we move forward.
I agree. And I think, Sandra, because we're all working remotely these days, maybe even having more external perspectives will help us progress quicker. So today we have the honour to speak with Tamara Rogers. Tamara is the Global Chief Marketing Officer for GSK Consumer Healthcare, the leading consumer healthcare company in the world. She leads a fantastic brand portfolio, which includes Sensodyne, Panadol, Voltaren, Advil, and more, and many, many brands that pharmacy is used to managing the access to for patients and the public. In this role, Tamara oversees the development of marketing strategies and portfolio management, product development and branding. Tamara came to GSK from Unilever, where she started in 1993 as a management trainee in the UK. She has progressed rapidly into positions of increasing seniority across local, regional and global roles, across general management and sales and marketing, so is ideally positioned to be in the position she's in. She's committed to building high-performing and diverse teams, so it's brilliant actually to have Tamara with us today. Welcome, Tamara.
Welcome, Tamara.
Thanks very much, Catherine, Sandra. Great to be with you. And probably the one thing that wasn't on my resume, which I always reflect back with a real sense of pride, actually, and I learned a ton. I actually started behind the counter in Boots, so a pharmacy chain in the UK. I was actually a teenager. I was put on the makeup counter, which, to be honest, I probably had no authority to talk to, but it was positioned right next to the pharmacy, and I at the time wanted to be a doctor, so I kind of gravitated towards the pharmacy end of the counter and found myself, where I could, helping out whenever there was a bit of a rush on, in terms of looking after the customers and chatting with them. So yes, I sort of feel like I have been a little bit both sides of the fence. But wonderful to join both of you today and to talk about a subject that's really dear to my heart. And I think in some of the stuff that you're starting to tee up, I don't know that we're massively far apart, actually. I think the sort of future that I can see probably is not massively dissimilar to the hopes and dreams that you would have as pharmacists and obviously the community that you represent.
Well, that's really lovely. I'm going to hand over to Sandra to ask the first question, but Tamara, you definitely have credibility by being on the counter. It gives us an insight into what the public want. It really does. Sandra, exactly. Over to you for the first question.
Well, you know what, Tamara, that's amazing. And we can call you an honorary into the pharmacy profession, because anybody that's worked and seen the challenges in pharmacy truly do understand where we're coming from. And now that we have your global view as a leader at GSK Consumer Healthcare, it's very exciting. So I just wanted to talk a little bit and maybe get your point of view on what do you actually believe will be the biggest challenges in healthcare globally as we move through the pandemic and post-COVID?
Yeah, so I think there are multiple, but why don't we just sort of try and stay focused? I think from the macro down to the micro, when we think about public health, and look, there were plenty of people who talked about forecasting this kind of a pandemic. But I think the world is now more on alert for this sort of thing happening. And I think that kind of global connectivity we've got and public health in an outbreak context. And historically, our healthcare services, doesn't matter which country in the world you go to, they've been very much focused on the individual and providing individual care. And in many places quite fragmented. And so a world now that needs to sort of join up better, understand, and I've seen incredible sharing actually, even just online, in terms of things that people are finding. Some of it not necessarily very accurate, that can cause some scares, and that's also something we need to handle. So there's that kind of need now for handling pandemics in health. Then I think there's a shift that we're seeing from, and I think this is something that a lot of healthcare providers have been trying to drive for, and the pandemic has been an accelerator for many things, but moving healthcare from the hospital and the clinical setting into the home and the community, where we know that recovery rates are better for people. You've got other people around you that are looking out for you in that community. And then kind of coming even closer in, but that we have really seen a need to protect our frontline staff. So whether it was the very visible celebration of the healthcare professionals in hospitals, or the less visible but actually unsung heroes that we have in the pharmacists, the pharmacy teams, and how we keep these folks who are on the front line safe and free from infection. It's a little bit, when we all used to fly, that thought of you put your life jacket on first before you help others. And how do we make sure that we are really protecting the frontline staff, both from infection, but also from burnout. So I think there are a number of challenges that we face, whether they're kind of global and macro, or right down to, you know, bringing it home to in sense of the pharmacists and the pharmacy teams.
Thank you, Tamara. That's really lovely of you to say. We actually had our opening ceremony of the FIP Virtual. This interview is underway during our FIP Virtual events. We had the opening ceremony on Sunday the 13th, and we recognised those that had lost their lives across the profession to COVID. And it was quite remarkable how many people have actually lost their lives that we know about, and there'll be more that we don't. So you're quite right. We did just a couple of things from FIP. We did a call to action right at the beginning to all governments and to make pharmacy recognised as an essential health worker. I think what we've been seeing since March is a greater awareness day by day, week by week, that pharmacy has kept its doors open globally in all our communities, no matter what has been going on, and they've been a point of access for all. 2 points I just wanted to add to this, Tamara, which can reflect before I hand over to Sandra, is one is the amazing way in which regulations, which may not have been challenged for years, have been relaxed to allow access and safety of medicines to take precedent. And the second thing is that countries learning from each other has been really powerful, so that what we don't want to see is a real clawback to what used to be business as usual around many of these countries and member organisations. Sandra, what's your reflections?
Yeah, you know what? It's interesting. We just did a global survey, which we will be releasing the results of shortly with McCann Health and FIP. And one of the things is that the pharmacists on the front line, accessibility, the number of conversations that are happening, their role as a trusted healthcare advisor, all of those things have really come to the forefront as they rise to primacy in elevating practice and how they engage with patients. And it really, all of the politics, everything has kind of dropped away for them to step in. We were discussing some trends and some things with some of the pharmacists in different countries. And, you know, we have stories of pharmacists coming in the middle of the night to do up PPE packages so that patients wouldn't have to wait and feel uncomfortable waiting in the pharmacy, and going to their homes to drop off medication. So to your point, 100% we agree that those challenges, and I think that they will continue as we move forward, you know, so yeah, that's great. That's a great perspective. Thank you. Catherine, I'll let you go to question number 2, but and it's less about question number 2, but as we continue this conversation, and let me open it up by saying, Tamara, congratulations. I read this week that you've been named as the global leading marketer by Marketing Week. So congratulations on that. That's amazing, an amazing accomplishment.
Yeah, to be honest, that's an accomplishment of my teams, because, you know, what people see being put out there is what my teams do. So so it's great to be recognised, but really that recognition is for what my guys do across the world, either global marketers or people in countries really doing amazing work. So yeah, that's recognition for them, not me.
Very humble as well, but yes, that's wonderful. Well, congratulations to your team. Considering that marketing is all about communications, and considering you are a global expert in understanding how consumers engage, we'd love to hear your thoughts on what you feel is the biggest opportunity for pharmacists as we move through the pandemic.
Yeah, sure. So I think the art of marketing actually starts with people, and has always been around understanding people, understanding their unmet needs, and then trying to figure out how do you best serve those unmet needs, whether those are with the fantastic products that you create, or whether they're the communications that help people understand what those products are and how they can help you improve your lives. And I think in GSK we talk about helping people do more, feel better, and live longer. So actually we have been doing quite a bit of understanding work ever since, well, we are ongoing, but ever since the whole COVID-19 thing hit. We've also commissioned studies, so we did some work with Ipsos, and it's clear, and the world I think knows this, that suddenly healthcare and your health, I think everyone knows how important health is, but this has really thrown it into light, into a perspective that people didn't have before. People are talking with language that they never used before. So, most people wouldn't have been able to tell you what PPE is or what an underlying condition is. And I think what we're seeing is people are realizing just how much their health matters, how precious it is, and therefore, wanting to take better care of themselves. We used to joke a little bit, it's a bit like trying to sell insurance to, university kids, or health, or pensions or life insurance. You're just not interested. You're only interested when suddenly things become a little more personal. So I think this has really made people want to think about their health. And then I think that's one big trend that's coming. We're seeing a lot more, you see Google searches going up, people are hunting for information. So then if we think about the role of the pharmacists, the pharmacist technologists, the teams in pharmacy, what we've seen happen to them is, these crazy hours, everything you've just described, Sandra. I mean, I know my own pharmacist, who I chat to quite regularly, just because my own kind of like fascination about what his job is and how he helps people. And I think what we've seen is they've become completely overworked. So as you said, there's many healthcare professional doors were closing. The only ones that were open with a pharmacist. And they have definitely started to play an even greater role in the community than they used to. And they were always there. But suddenly they were the only healthcare professional that you had access to, that you could talk to. And so it isn't just about dispensing the medicines, but it's that whole care that comes alongside around explaining to people how they look after themselves, what they need to do differently, and being there day in, day out. And as you said, sort of pharmacists delivering to people. If I don't know, Mr. Joe Bloggs comes in every week and suddenly he's not there, that's almost like the early alarm system. And I think pharmacists really suddenly started to spot some of these things. And so I think it's a front line of information around what's trending, what issues are starting to pop in the community, and what's happened to these individuals that you have taken care of, and are they okay? So that's a massively different role from, I think, where we were before. And all the advances in technology as well becoming really enabling. So I really feel for the pharmacist, because not only are you kind of delivering on your initial day job, now it's exploded into a whole arena, and then there is a wealth of opportunities. We've been doing some work to really try and understand, of all these things, what is actually going to be of the most use to the pharmacist and the pharmacy teams, and what is going to have the biggest impact for healthcare moving forward, and how do we find that sweet spot together? Because otherwise I think there is a real risk of burnout.
Yeah, and you know what, that is absolutely so true. I mean, we're seeing an increase in pharmacist triage and screening, where they actually now, a lot of that non-communicable disease, obesity and diabetes and all of that, the questions that would normally go to physicians are starting to flow back into pharmacy. And there's a real opportunity to be able to help triage what's going into the health system, to decrease some of the workload that's on the other frontline, care workers. The other thing is their role as trusted medication advisors. In the study we just did, 80% of them feel that it is a permanent change, but they feel that being that trusted healthcare advisor is one of the key opportunities that pharmacy has, and as well as vaccination and testing, which is key. Catherine, any thoughts?
Yes, loads, actually. You've just sparked a whole load of ideas, Tamara and Sandra, with the response there. I love the idea that we're on the front line of information. What I think COVID has done for pharmacy is it's made every single thing in pharmacy, the good things and the bad things, more highlighted and more acute. So pharmacy has always been there for all the communities. Tamara, you're quite right in saying that, the local community pharmacist is almost like the barometer of health of the community, spotting whether people are undertaking their regular little visits, or whether somebody may be ill or poorly. But that's been exacerbated during this time. And also some of the problems that pharmacy has faced, like drug shortages or information overload in the population, pharmacists are trying to navigate their way through that. I think I must say as well, Tamara, thank you for acknowledging your team. For me, that's a real sign of a great leader. And pharmacists themselves on the front line have realised that they can't do what they do and they can't expand what they normally do without the support of a great team. And that's where we're seeing the successes come from. But they are fatigued and they are, you know, overwhelmed at times. And as people have come out of their lockdowns in different countries, we're hearing a lot about how perhaps people are more understandably fractious and perhaps less than charming when they go in to receive care from their community pharmacy. So when I mention things like drug shortages or perhaps even access to counterfeits, even that big of an issue, which is one of our global problems that we face. Tamara, what would you say would be your thoughts on what will stop any of those opportunities being realised as you've outlined to us?
So I think in terms of the opportunities being realised, I do think we have to start with some understanding. And again, it's the kind of natural marketer in me. We need to understand of all of the things that a pharmacy team and a pharmacist could get pulled into, what are the things that are really going to make a difference? And you know, the pharmacist is not only a healthcare professional, they're also trying to run a business. You know, many of them, this is their livelihood. And when you go and you're trained as a pharmacist, there's some support in terms of how you run a business, but you've also got that worry on your mind as well. And so really trying to think about what are the things that are going, and that's what we're trying to do as we're doing research at the moment, getting insights. We're going to markets like India, China, the US, Russia, and Italy to really understand what are the areas that that potentially could have the most value, and then how can we you know, play a role in supporting that. So we recently put out our sort of pharmacist statement of intent, which I have to say every time I read it gives me goosebumps, because it talks about the unspoken, unsung hero that is the pharmacist and their teams, and how heroic they have been in really kind of normal times, normal moments that are actually, you know, are become extraordinary because of that moment of intervention. So we with this statement of intent, we're expressing we've had a long-term partnership with pharmacists, obviously, but we're expressing our intent to try to work together with you and with the pharmacists to try and figure out exactly what areas are going to add the most value. We believe there's a lot of value in the self-care space, and that role obviously that the pharmacist has in the community to help people take better care of themselves. There's so many benefits. We know, you know, governments are under enormous pressure from the burden of the cost of healthcare, and if people can proactively take better care of themselves, you're avoiding a lot of that cost of then dealing with the issues that then arise, you know, when people do fall unwell. So I think it is trying to figure out, how do we in the community get to better self-care programs that the pharmacist can be part of, because, you know, they are the healthcare professional and people have now found them. You know, it's amazing. Even like the street I live on in London, during COVID, suddenly somebody decided to put a WhatsApp street. So we have a Kenyan street WhatsApp, and everyone has rallied around each other and really hard to help each other. And that's London. London doesn't have very much local community, but the pharmacist is the center of that community. And so what could we do that could really try and address the big issues of things like healthcare costs, and address the amount of time that the pharmacist and their teams have to do the most productive outcomes on top of, you know, what was already a fairly busy day.
Thank you, Tamara. I'll hand over to Sandra in a second, but I think you make a really good point. Our campaign that we ran from March to June was #PharmacyHeroes, because we were just overwhelmed and quite moved actually by some of the over and above activity we saw from the profession, and because it was so evident, because everything else was silent on the high street or on the community streets that we all live on, I think that was really something that the profession wouldn't normally do. So it's the biggest marketing that the profession has ever been able to do for itself while they were just doing their job. Sandra, over to you for the next question.
Thank you. It's interesting, and I just want to go back to one point, Tamara, that you made about the language. And the changes that are happening in language and that whole piece around even the consumers and our patients are coming in with a deeper understanding. And that's really a struggle when you're frontline and helping them even to navigate through some of the complexity as we see the rise of science and looking for guidance as to what they need to do next from a healthcare perspective. So thank you for bringing up that point, because I do think it's key in how we talk to patients and how pharmacists engage. GSK Consumer Healthcare is one of the world's leading over-the-counter healthcare companies, and you just spoke about your statement of intent and the role that GSK can actually play. Do you have any other thoughts on how industry can actually, and pharma companies themselves can step in and work with pharmacists to better promote better patient health outcomes during these challenging times? We're seeing healthcare struggle right across the board, and managing these challenges has become that issue. Do you have any further thoughts on that? And I know you just kind of went nicely into explaining some of that, but any other thoughts you would have? Because one thing that we do know as pharmacists is that we do require help with time management, efficiencies, and how we care for patients. The day has not gotten longer, but the amount that we're asked to do has become significantly more. So any other thoughts on that?
Yes, I mean, I think as industry, and as you know, we have lots of industry associations, whether those are at a local level in the UK there's the PAGB, Europe there's AESGP, and then there's a global organisation as well. So there's many layers here where industry do come together, and pharmacists are represented well there. And I think what we're trying to drive there is the awareness of the self-care agenda and just how much it can contribute to society and as I said earlier, to alleviating the kind of pressures and burden of funding that the governments face. And I think that, as I said earlier, the whole pandemic has accelerated change. And I think we've seen change, and you referenced it a little earlier, Catherine, around different regulatory bodies in different markets giving more authorization, for example, to give vaccinations, so for pharmacists to give vaccinations. And it always astounds me, and obviously I came into healthcare 25 years into my career, but I've always been interested in it. But it always amazes me that such unbelievably qualified and capable individuals are not given more freedom actually to use their training and their expertise. So I think it's fantastic that we're seeing some of these regulations easing up where they can, where we know that people are perfectly capable of doing things like providing vaccination. And then in Germany, I think there was the ability for pharmacists now to access health information online and be able to start closing some of the silos and joining the dots around care and bringing some of those records together. So I think continuing to drive and see if we can drive policy change so that we can enable pharmacists to fulfill a greater role that they are fully able and trained to be able to do is great progress. One of the other things that we're going to be doing on the 29th of September is we're going to be holding a multi-stakeholder roundtable, and that's in partnership with Politico in Brussels. We've got some fantastic speakers. So we've got the president of the PGEU, the pharmaceutical group of the European Union, and a representative from the World Health Organization who is a representative to the European Union. And at this roundtable, we want to start to explore the role of self-care and how we can contribute to keeping Europeans healthy, and in that, what role pharmacists can play to support self-care. So I think it's, as I said earlier, it's this sort of really let's try and understand what can make a difference, and then let's really focus on doing those few things really well.
That is amazing. You know what, pharmacists have leaned in, and the whole point around the role that industry can play is a very important one as we do explore that increasing role. I mean, we're seeing pharmacists leaning in as health extenders, which are exceptionally needed as we move through some of the new challenges. The need for vaccination, mass vaccinations, chronic disease management that's been kind of pushed a little bit aside as a result of what's happening with COVID. The whole triage of self-limiting conditions, decreasing workload in the healthcare space, management of drug supply, drug shortages and supply issues, the whole issue around adherence and compliance and public health services are all extremely important as we navigate through how we're going to manage as a healthcare system. So that's brilliant. Thank you very much. Catherine, do you have any thoughts on that? Anything to add? Because I know FIP is doing a lot with a lot of those organizations.
Yes, and Tamara, I think the whole continuum from self-care, empowering everyone to be a little bit more aware of their health and even their ailments, as you rightly said, it becomes much more personal. Pharmacists have a big role in that. And actually, whilst you're the first in these interviews, we're planning to have an interview with Judy Steinmark, who is the CEO of the Global Self-Care Federation, as part of this triplet. And I think the self-care agenda is massive. It's a massive thing that we need to grab. It's not just pharmacy's thing, but it's, you know, everybody's thing, which I think is really important. All the way through to what Sandra's just said, which is, you know, pharmacists and regulated pharmacy workforce being part of the vaccination solution, as we need populations to be vaccinated, not just for COVID when that comes, but all other potential diseases that can be vaccinated against. We have to get more responsible about this. So tomorrow there's a whole continuum here that I feel pharmacy has a part to play. And I don't know, before we go to the next question, whether you've got a reflection on that.
No, I think I completely agree with you. And I think even just hearing both of you two talk about some of the challenges like vaccination, like drug shortages, this comes back to some of the other roles that pharmacists have to play in running a business. And, you know, I look at my own business, forecasting is one of our challenges. Really trying to figure out what medicines are going to be needed, where and when. And some of our supply chains are, you know, they take some time. We've got super high quality production to make sure that we've got, you know, really good high quality medicines. And so even things like just getting your forecast accuracy. I mean, we saw unbelievable demand for some of our products, and we had to make some really tough choices. So, you know, for example, a Panadol, instead of doing lots of different pack sizes with different numbers of tablets, or we had to reduce it down to something like, I don't know, we went from something that was 120 down to something like 60 different pack formats for the world. So just our lines could run efficiently. And so you've got that burden as well of trying to make sure that you're forecasting accurately what is needed. And then you talked also about counterfeit. You know, we work really hard because clearly we don't want anybody at risk by using a counterfeit product that, you know, they can look incredibly similar to branded products. So in that continuum of care, I completely agree. There is a great role for the pharmacist and for industry and regulators and government to be working together to try to find the best solution.
It's interesting, and I'll just add this point. In the study that in the research we just did with FIP, and we interviewed about 200 pharmacists across 19 countries, I can tell you one of the biggest things that they identified was that short supply of drugs, and analgesics and pain meds were one of the top that they identified. And it's really difficult when you're in a pharmacy, you have patients come in and you're trying to navigate some of those things that are really truly out of your control. So working, you know, and you talk about forecasting and all of the things that GSK Consumer Healthcare, for example, as an industry partner can do, all of those things then help actually supply overall better healthcare through management of medication and making sure, and pharmacy is very much about making sure that the right patient gets the right medication for the right ailment. And so it's important to know that things like that are being looked at outside to be able to aid those frontline healthcare professionals.
And I think there's something as well about how can we better harness things like tech. I mean, I do remember being amazed I was in a pharmacy in Italy and they were still faxing orders. And I don't think that was unusual. And I just come from a fast-moving consumer goods world where everything is done, you know, a lot of AI forecasting, and letting the machines kind of see what the demand was to then forecast what was going to be needed, and yet we're still faxing things. And so I think there are ways that can unburden the workload by allowing tech to help, that then frees up time for the pharmacists to do some of the things that perhaps they have more passion for than filling in order forms.
Yeah, I think pharmacy, and Catherine, I'm laughing because I think pharmacy still may be one of the few professions outside of hospitals that use fax machines as a primary form of communication. I'm not sure, but it's kind of funny you say that. You're right, and tech as an enabler to be able to enable practice is extremely important. The one thing that I tell you pharmacists are overwhelmed with is the amount of tech that is being offered to them as solutions, but yet they're just adding into the workflow. So all of those things, having them and people that truly understand the space help with that is so essential in everything that we need to do.
Yeah, I agree.
Yeah, I think it's about having the right tech at the right time, isn't it? And sometimes you need a paper and a pen. Less times you need a fax, because I don't know who I would fax my fax to now, because I don't know if they'd have a fax machine. But additionally, tech needs to be enabling, not limiting. And sometimes, with this digital agenda we're all part of now, what we find is a lot of people struggle with the tech as well. So it's having that little buffer around all the solutions we give. They have to be very practical. But I think that's where we're all on the same page with, aren't we?
Yeah, and that's where bad tech is hard to use. That's where the person who uses it has been forgotten. The user experience, that has to be the priority of getting that right, so that it's intuitive and easy to use.
And you know what, Tamara, when we've talked about this accessibility on the high street, most of us will have parents and relatives who have not been able to get in to see their GP. So their pharmacy has been a first line of contact, and it's face-to-face.
Yes.
And sometimes you need that as well. The world of Zoom is great, but we need a bit of everything, don't we? We just do.
Yeah, and we all know the biggest fallout of this is in that mental health space. Yes. And that really needs that face-to-face piece. So, where we're trying to drive changes, how do you use tech to enable you to do the stuff that is mundane and boring? And how do you then free up people to do the things that only people can do? And that face-to-face piece, which is exactly where the pharmacists have been there. They have been there for people in their time of need, when there is, few else that people to turn to in the healthcare professional space. So you're exactly right. That face-to-face is such a critical part of fulfilling that need in the community.
Mm-hmm. And you know what, we're looking at, and I'm glad you brought up the whole piece around mental health, because pharmacists as frontline workers really do often take the burden from a mental health perspective. And there's a lot of challenges, and we're hearing it all around the profession. As we do multiple and work with multiple stakeholders at McCann Health, I can tell you one of the biggest things we hear is the impact that mental health issues are having on the frontline workers, as well as the patients that are walking into the stores, or going into hospitals. So there's so much work to do, and it's just amazing to have partners like yourself, Tamara, and GSK Consumer Healthcare. So thank you. Catherine, I'll pass over the last question to you as we clue up here, but it's been fascinating conversation.
Yes, it really has, Tamara. Thank you so much. So we thought it would be really useful to summarize, or to kind of close the conversation off, mainly because we could talk here for maybe another 3-4 hours on these topics, because they're so good. Exactly. But Tamara, if we were going to give you an opportunity to share with the pharmacists listening to this interview your top 3 messages for them to continue to navigate these difficult times. We do know these difficult times are here to stay for some time yet. And that resilience piece is going to be really important. So your top 3 messages, please, Tamara.
Really simple. So the first one is a massive thank you. Not only personally me to my own local pharmacist, but to all pharmacists for their commitment to patients during these unbelievable times. It's been an outstanding response, and as we've said, I think people are beginning to recognise it now when they were celebrating kind of the more visible, but an outstanding response from this less visible group who have got our backs in terms of healthcare. So the pharmacists, the technicians, and the pharmacy teams. It's been a really challenging time. So a massive thank you. Secondly, kind of where I started, which is you have to look after yourself. There's the resilience point. There has been such changes and demands on you, and you can only keep going. It's that horrible saying, it's a marathon, not a sprint. I hate cliches, but it's kind of true. This is for the foreseeable future. So you've got to look after yourselves in order for you to be able to look after others and to deliver the service and the care that you deliver so well. So then the last one is sort of thinking a little bit more future. You are amongst the most trusted counsellors, educators, health advocates in the world. You see and speak to more people than any other healthcare professionals do. And you're really well suited to the trend that's coming around more of a decentralised approach. So genuinely vital to the future success of healthcare systems around the world. So let's think together how we can reimagine that so that it becomes a really fulfilling role that you play above and beyond that you're doing today.
That is amazing. Thank you.
Yeah, thank you so much, Tamara. I love the recognition. You're speaking directly to the pharmacists there, and they are ideally suited. Sandra, you and I have been talking now for months about these issues, and this is pharmacy's moment, really. I mean, we're all about serving patients and the populations, and you've really captured it well, Tamara. Any final reflections, Sandra, from you?
No, only the 3 points are well received. And on behalf of the profession, McCann Health and FIP, we thank you very much for taking the time out today. You know what, pharmacy is very much ideally positioned. And now is the time, and Catherine and I, have been bantering back and forth about the burning platform has presented itself, not because of anything that's happening within the profession, because as a society, we are undergoing massive changes and stresses as a result of this pandemic, the economic challenges it's creating, all of those things that we hear about in the news every day. And pharmacists are frontline, they're out there. They are the ones that are staying late, coming in early, making sure, as are other healthcare professionals, but making sure that the people that don't have immediate access to the healthcare system have a trusted healthcare advisor to go to. So on behalf of the profession, thank you. Catherine?
Yeah, I reflect and expand on Sandra's thanks there, Tamara. We're all super busy at this time, so thank you for making time to give us an external viewpoint. It's exactly what we needed. So we're planning to hold 2 more of these. We're going to have little triplet interviews. The next ones will be with Junice Denmark, as I mentioned, from the Global Self-Care Federation, and then one with John Cahill, who's the global CEO of McCann Health, to afford us 3 different perspectives. And tomorrow it may be down the line that we want to pull you all together to get a bit of a panel debate going on this, because we don't want to lose this moment. Fine words are fine, but what we need now is to really grab the moment during these really tough times. But I also wanted to thank you, Sandra, for the support and discussions over my time at FIP so far, and also recent months. I think COVID affords us a little bit of time to get our thoughts in order, and that's possibly one of the only benefits we see really from this pandemic time. Thank you, Sandra. Thank you, Tamara. Final words over to both of you.
So massive thank you. We've run for longer than I think we thought we would, which just shows just how much passion we have for this. Look, I think this pandemic has been an accelerator of many things. Some of them not good, but some of them, really are accelerating the change that all of us hoped and dreamt for. So I think it is about seizing this moment so that it doesn't then slip away if there is any sort of normal that we come back to. Let's seize that moment of what's been accelerated here.
Wonderful. All right. Thanks, everybody.
Love it. Thank you. Thanks, Tamara. Thanks, Sandra. Bye for now.
Bye for now.
Bye.